starting up first the similarities and then going to differences. If we sort of get past the concept that children are different than adults, then that helps a lot with our understanding that migraine really is a disease that spans the lifespans, and that really approaches understanding that it's a genetic disease. So using that as a basis, then we have to understand why does it appear to be different in children. And the biggest factor is that children are developing. Their brains are developing, their bodies are developing, their ability to express themselves is developing. And all those factors make it more difficult to potentially understand and identify the headaches, especially when, as I tell the children oftentimes, it's your headaches, not your parents, even though you may get them from your parents. And so you have to be actively engaged and involved. So just like an adult, where they have to be involved and part of the care team with the healthcare providers that are treating them, so is the case for children and adolescents. Trying to direct it through the parents doesn't always work. Trying to direct it through the patient, who is the child or adolescent, is important. So they have to be engaged, they have to be involved, they have to make the decision process. With that in mind, if we do look at sort of the sort of four major areas that are involved in migraine management to help treat the acute headaches, as well as not just the headaches, but there are other episodic or periodic syndromes that we now recognize occur in adults too, but also maybe more evident in children, where we're trying to make all those better. So we already discussed a little bit the acute treatment, so finding an effective acute agent. One of the unique factors in treating children and adolescents is that it is weight-based. Should be probably weight-based in adults. Not adults are all the same size, but they're treated all the same size. In children and adolescents, they're not the same size. So using a weight-based approach is oftentimes necessary in both the acute treatment as well as the preventive treatment. And then finding something that's developmentally appropriate. Young kids may have difficulty swallowing pills, so needing a liquid medication may be necessary. So integrating it and how it fits best in their lifestyle, which also is similar should be in adults. Children also may have different impact factors. As an adult, if we miss work, we may not have our job for too much longer. Children have a little bit more flexibility in missing school, but missing school means they're missing learning opportunities. So assessing not just learning in school, but learning in social interactions with their peers as well as the family is all important components that having a severe headache attack may remove them from. So assessing their disability and impacting how their disability may be influencing it. Fortunately for kids, there's not as many comorbid conditions that seem to influence the treatment choices, but they do exist. Anxiety is one that's very common in a lot of kids, and sometimes recognizing that underlying factors of anxiety are important in relieving their management. And oftentimes the cognitive behavioral therapy component can be focused not only on the pain disorder, but also on that anxiety. So to answer your question, I mean, it's not that kids are just little adults, but kids do have the same disease that adults do. And taking into the factors of the brain development, as well as the size difference between children, adolescents, and adults in determining the dosage of their response may be necessary.